implementation yet. It is one of the areas where, when I'm given the nod, I'll seriously begin to look at. I've identified a number of opportunities in terms of what we should do within the health sector. Bills that we have passed, assented to become acts that have not been implemented. We have mentioned two just now, and I believe when I get in there, I will do what I can to get the necessary allies done, and we'll see to the implementation of these acts. When you look at our manifesto, the party and the president are talking about scaling up investments into the health sector. And I believe that commitment will give us space to be able to access funding to do the implementation of some of these acts. There are about 3 or so acts that were passed last year that are yet to see implementation. And I think time is there now for us to pick them to start implementing those acts. And all these things will be taken care of. The decentralization of the mental facilities will be taken care of, and I think the spells are out. And when we get extra funding into the health sector, these things will be tackled.
The bills were not passed last year. The bills were passed between 2011 and 2012. The ones that he's talking about, 5 or so bills. So it's not last year that the bills were passed.
The record reflects that. Honorable Part.
Thank you, Mr. Chairman. Congratulations, Honorable Agyeman Manu. Honorable, my first question is, if given the nod, how do you intend to rescue and restructure the ailing National Health Insurance Scheme? Thank you.
Thank you, Honorable Chair. I must open up to tell you that one of the very reasons why the President pushed me to the Health Ministry.
Chairman, objection, push you. And you didn't fall.
Honorable Chairman, I didn't fall because I'm up to the task. One of the reasons why I was assigned this duty was to take a critical look at what we can do to ensure that we find some sustainable funding and some workable arrangements to restructure and transform health insurance from the level where we are now, that you call ailing, to let it look like it's working again and to sustain it for its survival and growth. So,
sorry, I want to understand. You said to let it look like it's working again, or to make it work again?
To make it work again. Thank you, Mr. Chair. I have looked at a report of the committee that President Mahama set up to do a review. The recommendations in there are quite insightful. And we're thinking of also putting in a little bit more management expertise. And I believe with a little bit of funding, innovatively coming in, we can get it done. Health insurance, my colleagues, I think when I'm giving the note, that is an area I will continuously plead with all members of the 2 political divides, the large ones, to take away the little tiny politics that we do away from. Because if you are able to turn round the fortunes of the national health insurance, all of us MPs will be happier than any other stakeholder. At least the demand burden of support for healthcare will have been taken off completely from our heads. And I think that will be good for us. Apart from that, we will have given something that will make us, as representatives of the people, happier, in the sense that people can access healthcare so easily and affordably. So we're going to look at the best practices that we can put into the health insurance to, and I want to quote the speaker's words, make it work again. And I think for now, I wouldn't be able to give you very strategic things there. We've got an opportunity. The committee's report is ready for us to implement. We'll look through and add on a new, more innovative things that we think we can do. But when it comes to funding, I believe that you will assist us to come up with innovative ideas. I don't have everything. Whatever proposals I can grab from you, I'll present to Cabinet, and we'll see through it. And I think that will be what I can say for now.
Okay, thank you. Mr. Chairman, I'd like to ask the honorable nominee that he's talking about funding, but I see another big challenge that we have. Moving around the country, you realize that the number of health structures littered all over the country, which for the past 8 years has not seen any attempt to improve on those structures. A typical case is at Konfanoche in Kumasi. In my constituency, I have a district hospital, and a ward had been constructed for the past 8 years, and it was never continued. So I realize that there is a big challenge here. Can you assure me, or the whole of Ghana and my constituents, that if given the nod, you are going to pursue and ensure that these structures are completed? Thank you.
Thank you very much, Honorable Chair. It is correct that there are quite a number of these construction projects that have been started that haven't seen any progress on them for years. I've also visited Fomena before, and I know what you're talking about. Several other areas. Even Bantman, this is Cortes, is still hanging there. But the good thing is that, like I said earlier on, during the preparation to appear before you, I have done a lot of research and a lot of work. There's a lot of investment projects that are going on now in the health sector. Rehabilitation upgrade of Tamale Teaching Hospital, 8-number hospitals project across the country, rehabilitation of Bolga Hospital, construction of 10 polyclinics in Central Region, construction of 5 polyclinics in Greater Accra Region, 1,000 new CHIP compounds across the country, dedicating a good proportion to these to maternal health and neonatal care services. 7 district hospitals, including those at Dodowa, Sekendi, Fomena, and Garu Timpani, under design now. Construction equipment of 7 district hospitals and integrated IT systems in Ghana. Several of them. 5 district hospitals in Sola, Tonlon, Sumenya, Bupe, and Weta, and the polyclinic in Bamboy. And other programs and projects that seem to be working within the health sector. Quite a large number of these projects have got funding, and work is ongoing. So now, if you come to look at our manifesto pledges and the President's will to expand healthcare facilities, health infrastructure, and equip them, I believe that some of these things will be picked up. The first few things that I will try to do when I get to the ministry is to try to request for a stock taking of all these facilities that have been left undone, and we'll look at why these things are still there. And I'll submit some of these things to Cabinet for the approval for funding. And the way we're going to go around certain things, I believe the Ministry of Finance will help us. My ministry doesn't generate so much, and we live on the largest of the Finance Minister. And when they give us the money, I think we'll work. I like traveling, and I will do a lot visiting project sites and collecting data for myself. So I wouldn't tell you rest assured, because things will depend on availability of cash, inflows into the sector. But with our commitment to do that, I believe the President wouldn't let us down. He will get the money for us to do the work that we should do. Thank you.
Honorable Nilati Vanderpoy.
Thank you very much, Mr. Chairman. Congratulations, Agyeman Manu, Minister Designate Health. First, what do you make of this policy direction of professional medical practitioners leaving the awards and taking up administrative management of hospitals?
Mr. Chairman, this is an opinion my colleague is soliciting. This is an opinion my colleague is soliciting.
Please answer.
Mr. Chair, I just wanted a clarification.
Is it an opinion? Please answer the question.
Mr. Chair, with your indulgence, let me please make just a little comment. Since after the elections, several things have happened. Parliamentarians have been sworn in. The president has been sworn in. We have changed sitting positions in the chamber, but not until this afternoon. I have never realized that change has come. The tsunami, look at where the tsunami has placed me. I used to sit where you are, and I was throwing the questions, Mr. Chair. Now, technically, I can't ask a question. So I now have realized that change has really come, and I congratulate everybody, Mr. Chair.
Oh, Chairman, not even when the president publicly and in Parliament announced you, did you notice change?
No, I only felt something, but now. My colleague, sorry, Mr. Chairman, I have opposed the idea of trained medical practitioners taking up administrative positions. But when you sit down and interrogate the matter, you come to realization that when you're practicing a profession over years, you can get bored with what you are doing. You do repetitive work all over, 30 years, 40 years. You are treating people, you are injecting people, you are cutting. Then you sit back, 30 years, this is all I've done. And it can be very, very laborious. So you may want to try to do something else if you have the interest, you have the capacity. And that is the reason why it's like we will have to compromise and accept that concept to operate. After all, not very many of them want to leave to become administrators. But then even before they come, they go to do some post-qualification training as well to give them the necessary skills they can use to do the new things that they may want to do. And the variation in the work duties, I think, is also good for productivity. And I wouldn't say that is a very bad thing. But where we need very critically the services of a particular person, I don't think we will oblige to allow him to go and sit doing administration when somebody else can do that. So we look at some of these situations and handle them in a very delicate manner.
Realize that if you have not been given this opportunity to offer this opinion, you have been confronted with what you have said publicly versus what you're doing in your ministry. You should be grateful to the questioner. Yeah.
Chairman, let me thank my colleague, Ni Lamte Vanderpoy. You used to be on my committee, is that not correct? Thank you.
Precisely the reason why I asked this question, because you first expressed this opinion before the Public Accounts Committee. Mr. Chairman, my second question. With your background, what are you taking to the ministry to prevent these serious issues about improper management of accounts and, people mismanaging funds and the rest, reported cases of these at the various, especially at the central hospitals?
Thank you very much. Mr. Chairman, my background indeed is management accounting. I've been trained for commerce and industry. Apparently, those days we called that area instead of cost accountants. And we work to manage. And when you're managing a corporate, some instances we call the working capital management and things like that. That is where the financial management and accountability and those issues come. So I'm going to go into the ministry with a very huge, extensive management background and expertise. I studied and practiced in 2 large corporates in Ghana, and I think I left some marks wherever I worked in Ghana. I did some good work in Gamot, which transformed it now into Toyota Ghana. And even Memtimba, I left a mark there. So if you look at the entire ministry or the health sector as a corporate entity, there are things there that are not the exclusive, how do I call it, tasks or responsibilities for health professionals or health workers. Let me take the ministry, for example. What we do there is managing the human resource base of the ministry. That area has a very large labor-intensive affair. When you're managing the human resource of the ministry, you are looking at their training, you are looking at their safety at work, you are looking at their welfare, you are looking at their safety and a lot of things that will motivate them to work. When you come to the funding, we have a very large budget. If you look at the budgetary allocation, health and education seem to have very large ones. In addition to the GOG releases, we also have a very large donor funding programs and projects, so there is some level of, how do I call it, funding into that area. And you need some level of management, financial management expertise in that area, and I think that is what I'm taking into the ministry. And it's related or other agencies that are close to the ministry, like Health Insurance Authority, Food and Drugs Board, and all the new regulatory bodies that have been, established quite recently. So I'm going there to do some serious management to ensure that the labor that we have in the highly skilled professionals, and I must tell you, the health sector has a very large number of various categories of health professionals and workers, and managing them can be a multi-complex sort of situation. And I think that is what I'm skilled to go there to do. And I believe my skills will have a bearing on the time that I will stay in there.
So, Chairman, my last question. Malaria is one of the highest, statistically, possibly the top-ranked killer in the country, especially with children. Sanitation, improper sanitation has been noted to be one of the main causes of the incidence of malaria. A lot of money is spent on malaria management. Don't you share the view that if we could also some of this money to the management of sanitation, in a way we will be doing what the cliche, prevention is better than cure?
Thank you, Honorable Chairman. When I heard the President announce the creation of a new ministry that will be in charge of sanitation, my own plan that I will take to the ministry, I've put down that I would need to collaborate with that ministry and the Ministry of Local Government for us to do more on sanitation. I believe that if you're able to mount programs and projects that will prevent the occurrence of diseases, we may have done so much. By the way you put your question, the ministry itself wouldn't have releases to actually use to support sanitation. I would rather will expect that we will come with programs and projects that will also help the other ministries that are charged with sanitation. But we will collaborate with each other and see how best we can work to actually do sanitation more efficiently in the country. Thank you, Mr. Chairman.
Honorable Agyeman.
Thank you, Mr. Chairman. Honorable Agyeman Manu, congratulations. I've known nominee for over 20 years. Indeed, when we were part of the MPP youth wing, he was an old man, but he was part of the youth wing. After he was an old man, indeed, he was a patron of the youth wing. Thank you so much. Yes, honorable nominee, given your background, yes.
Can I correct him a little bit?
What are you responding?
Thank you, thank you. You left some things out.
Yes, honorable, given your background, how do you assure the committee, and indeed the whole country, that after the MPP had accused the NDC and President Mahama's government of supervising the highest number of strikes in the health sector, with you in the saddle, the situation will be minimized as much as possible?
Thank you, Mr. Chair. Mr. Chair, with your indulgence, I just want to remind my colleague that I wasn't just a member. He tried to correct it. I was a patron, and I was funding them at the time when I was a little bit endowed. So you should have added that. Mr. Chair, on a little bit more serious note, the strikes and agitations in the health sector has become a commonplace minority. But with proper management of the human resource you have in the ministry, if your labor is very well motivated, I don't think strikes and agitations will come. But in all these things, you will need a basic platform to mount. Constant, frequent engagement with the associations and the unions, I think, will be a very ideal thing. Understanding now is the fact that almost all service conditions for the various categories of workers are completed. Some have seen some level of implementation. They've started implementing, but we are yet to even start implementing others. What I've dreamt about to take into a ministry immediately after you give me the nod is to engage all of them and to request for a truce for 6 months, and I believe I'll get that, to give me space to study the peculiar challenges that they have that have been causing these agitations. And like I said earlier on, I believe with engagement and some support from my colleagues in cabinet, listening and giving them, meeting them halfway on their demand trajectory, some of these things can be brought down very, very, very well. So we'll manage it. It's a very delicate issue, but I pray that God gives me the patience and grants me the wisdom that can enable me to do that work.
Chairman, I may have a follow-up. What will you do to improve the HRM system of the Ministry of Health in order to avert the strikes you just referred to?
Mr. Chair, I was once a Deputy Minister for Interior. At the time, we had about 20-something thousand police officers. And any time I met the IGP, well, the question I asked him was that, how does he assess the last police officer in the remotest parts of our country. Because you go in there and you saw files of 24,000 human beings, hard copies, manual system, and they couldn't give me an answer. So there's a lot that we can do in there. You see, if you forget about a nurse, if you forget about a medical person, very far away, and for 6 years, nobody invites him for any interview for promotion, definitely there will be agitation. If you ignore an association, you don't put premium on any of these associations, you regard one bigger than the other, you don't want to listen to them, you have agitations. So you do some little reforms and restructuring. You study the challenges, you look at what is there that is causing these challenges, and work on them. You can have some officer who may be receiving their petitions and wouldn't bring them up for you for any discussion or any arrangements. Before you are aware, it's in the drawer. And it will need somebody to come from Kolebu to say, Minister, we brought you this thing. Then the minister will say, I haven't seen it. Then before you go, it is sitting somewhere in the registry. These are the little things that we can correct immediately to get things going smoothly in the ministry. Thank you, Mr. Chair.
Thank you. Mr. Chairman, the honorable nominee, another major issue which is scrubbed up recently, in fact in the past few years, is a capitation grant. Capitation. But capitation, the real term is per capita payment policy, which was started in the Ashanti region and which the health authorities promised to send across the whole country to various regions. Have you had the opportunity to study this policy, and what do you think are the challenges of such a policy?
Thank you, Mr. Chairman. This policy is a cost-saving policy to cut down expenditure levels for treatments and healthcare to enable health insurance sustain itself. I have criticized it some time back. At the beginning, I didn't have a very good understanding of how it was going to work. And as at even now, after they've rolled out and deployed into another 3 or so regions, the challenges are there. It takes away consumer choice. So we are looking at putting premium on cost saving as against where a member of the association or the insurance will go for service. Again, we will need to fine-tune the policy. In itself, I think it's a good idea when it comes to cutting costs, but the challenges are such that we may have to take a real look at it and see what we can fine-tune. I've been criticizing that if you are sitting in a village where you have a small facility without a doctor, and that is where you are going to do your health insurance, you are being denied of the care that you can receive from a district hospital where you may have 2 or 3 specialists sitting in there. And I believe when I get in there and I continue studying the policy and the challenges and the implications, we can do some seriously fine-tuning and get it work in the right order.
Thank you. Honorable Minister of Health Designate. Another major issue in the sector that you're going to oversee or to become the minister is the accreditation system under the National Health Insurance Authority. I want to find out whether you've identified some of the weaknesses and challenges, or indeed whether the directors and officers you're going to work with have briefed you enough about some of the weaknesses and challenges associated with accreditation of health facilities by the National Health Insurance Authority, and how do we overcome some of these weaknesses and challenges?
Honorable Chair, I wouldn't want to think that I've had in-depth discussions in this area yet. I have assumed that accreditation that is being done by the Health Insurance Authority as it is now seems to be working, and I'll have thought to rely on that. When I get in there, I'll quickly do a very quick study on that in that area and see what new things that we can put in there, again, to fine-tune the system.
Honorable, no, on your side. There you go. Oh, no, sorry, something he said.
Thank you very much, Honorable Chairman. Honorable Chairman, it is captured on page 117 of the manifesto that the NHIS has collapsed over the past 8 years. Mr. Chairman, how can, Honorable Nominee, how can you describe a scheme with utilization rate in the range of 33 million and a membership of around 11 million as a collapse scheme?
Thank you, Mr. Chairman. Mr. Chair, the NHI has an objective. The NHI was not established, you will agree with me, to register members. So we don't assess the activeness of NHI with membership numbers. We established NHI as the objective to provide affordable, accessible healthcare to our people. So the numbers increase to 11 million. Utilization goes up that much, right? I don't understand even what you mean by utilization. Just attending the facility, or attending the facility and getting care, medication provided without you buying out of pocket. These are the type of things some of us want to use to assess the activeness of health insurance and the efficiency of health insurance. So if you're delivering health care, you are not just looking at OPD attendance, and then even if people go and they make them pay, and it is paid as attendance. If you are talking about claims and what we are paying and people are not complaining, these are the type of things we can use parameters to assess the working.
Chairman, I may have a
collapsing might be a very harsh word, I must admit.
Yes.
But I don't think that is what we are debating to do now. I wouldn't have, if I were writing that portion of the manifesto, probably used collapsed, because at least there's a presence of it. People are registering, that is correct. But you know the problems that we have with health insurance. You also come from the same rural area as I do. And I don't think, Mr. Chair, you allow us debate now. The bottom line is that when people go and they ask them to come and buy their own drugs, they come home and tell us MPs that the fund has collapsed, right? These are the type of things. When somebody calls you as an MP and is calling the MC in my area, and then it comes onto my phone line, and I pick it, and he says, oh, Honorable, I'm talking about the name of that. Then I said, what is the problem? I've been operated upon. I've been discharged. I'm here for 3 days. I cannot pay, so I can't go home. And that person is sitting in Doma Presbyterian Hospital. And Mr. Chair, with the indulgence, let me recognize the presence of Doma Presbyterian Hospital to come to support me. Then I go and pay 2 million for that person to go. Please, please, please. Honorable Chair, you are distracting me. Please address the chair. Honorable colleague, the questioner.
Please ignore him and answer the question.
Thank you, Mr. Chair. You have another opportunity, so wait. You see, like I was saying, then I go to pay 2 million, and the person is discharged. And he goes home and tells the people around him in the neighborhood that had it not been the MP, I would still be sitting in the hospital. When you go and tell that person that health insurance is working, honestly, he wouldn't say yes. So it's a passionate thing. And I told you earlier, Mr. Chair, that this is an area where we have to take away some level of politics. And together, the two sides, we are representing the people of this country. Look, if it's President Mahama, or President Mills, or President Komfo, or President Nana Nana Ado, I don't know how to add president to Nana, so somebody should teach me. So, you see, the Excellency Nana Ado. I'm learning, you know. So I mean, we all been calling Nana, even at here you call Nana, and I think that is a good, respectable title as well. So now, whoever makes it work, it's a credit to him, but we are all benefiting. And that is why I say that let us face facts and let us take away the politics out of health insurance and let us tackle it. The harsh word that is put there will even prompt whoever is going to be there that my colleagues are looking at this very seriously. If I'm not able to do something, I will still continue to use this very harsh word. What will happen to me, the minister? So it's harsh, I must admit, but we will work together to bring it up. Thank you, Mr. Chair.
Mr. Chairman, I'm happy the nominee has admitted that collapse is not correct and he wouldn't have used it. Mr. Chairman, my second question, Mr. Chairman, under the Labour Act, certain categories of people who provide services attempt to be, their services are considered to be essential, and therefore they are not supposed to go on strike. And doctors are one of such group. But in spite of this provision in the Act, we see our doctors always going on strike. I want to find out from the nominee what he will do to ensure that this particular provision is complied with. Thank you.
Thank you, Honorable Chair. Honorable Chair, I think I've answered this question, but I want to reiterate and maybe give more specific demands even from this, from the chamber. Mr. Speaker, doctors are demanding certain things.
At this table, there's a chairman. The speaker is sitting at the other side, please.
Mr. Chairman, I believe that the agitations that we are all scared in the health sector can be brought down. We're talking about doctors who by law shouldn't go on strike. But if we meet their demands, we may not even make references to the law. They are looking for tax waivers to buy vehicles, for example. If you sit down with them and Parliament will approve tax waivers for doctors to buy their vehicles, I don't think they will continue agitating, so that law will not be applicable any longer. So when we meet them halfway, and I said it earlier, and provide their demands, I don't think these things can go on and on and on unending. They themselves wouldn't be happy to see themselves being branded as perpetual strikers. No, that is not what they want. But it looks like what they are demanding, we're also not beating them to the level where they'll be satisfied, where we can motivate them to concentrate in working than coming out with agitations. So it is a problem that I'm not the only person who's going to solve. I will engage and I'll bring their demands to the fore. And I believe, colleagues, when things come to the chamber for approvals to support them, you will help me get that thing done. And that way we will all have assisted in solving the challenges. Thank you, Mr.
Chairman,
Chair.
I have a follow-up. Having listened to the Honorable Agyeman Manu, is he informing this committee that he intends to improve the conditions of service of doctors by granting tax exemption for them to acquire vehicles?
Honorable Chair, that is the wrong impression my colleague seems to be alluding. I'm saying that if that is their demand, and I'll bring it to the fore, you will assist me to solve a problem if you also accept what I bring and approve for us to do. If that is not the situation, I'm not going to impose that on them.
So, Chairman, if it is brought to the fore, how do you intend to solve that problem?
Mr. Chair, when we get to the bridge, we'll cross.
No, because, Chairman, I'm saying because I chanced to chair negotiations with health workers generally and in particular GMA, and I'm aware on authority one of their specific requests was to this effect. Will you give meaning to it?
Mr. Chair, I'll continue studying and I'll consult him. And then together, I think we can solve the problem.
Thank you, Mr. Chairman. Mr. Chairman, the MPP promised to restore nursing training allowance when they win power. They have won power. Can the nominee tell us when should nursing training students expect full implementation of this promise? Thank you, Mr. Chairman. With all the risks that comes with it.
Mr. Chairman, to my understanding and the best of my knowledge, I think the previous government started doing something like that. So there is work in progress, and we are studying the numbers. Yes, we are studying the numbers. Me alone sitting here cannot tell you when this will be done. Definitely, yes. I will need some resource allocation from the Ministry of Finance. I will need some level of cabinet approvals to be able to go to do that. Honorable Chair, I have asked the ministry to do detailed analysis of the cost implications of this policy. Yes, I've used the word reservedly, detailed. I can give you numbers as I sit here that might not be very, very, very accurate, but these estimations don't work when you're doing serious budgeting. So when we go through that detailed work, definitely during the budget time it will be announced, maybe probably even before. But the party and our leader, the President, His Excellency Akufo-Addo, is committed to it, and we will get it done. I was thinking when the previous regime started paying, was it 150 or something, there were some numbers, but I don't want to rely on it. Honorable Chair, as I sit here.
Sorry, just clarity. When the previous government was paying 150 of what and for what? Just for the record.
Oh, they were paying to nurses as some subsidy or support to nurses. You know, yes. So I'm still studying that area. That is why I said there seems to have been some work in progress that has commenced, and we continued in that direction. You know, so I can't give you numbers of head sitting here when I've asked that. Like I said, I haven't been to the ministry to sit down full time to start working, right? I'm only gathering some information, and I want to have full confidence in the numbers that I churn out. I don't want to come here again and say, oh, sorry, I gave you wrong numbers. No, I want to wait a little while to have some confidence in the numbers that I get. Thank you. Honorable Chair, my colleague keeps on heckling me. Is that part of the rules of this committee?
Honorable nominee, you're being a chairman here, and you've been an active member for the past 8 years, so I know you know what happens in the House. Now, Honorable Ada.
Thank you very much, Mr. Chairman. Let me congratulate my senior colleague and good friend, and also commend him for the good job he did with the Public Accounts Committee. I think the whole country knows what is done with the Public Accounts Committee that is helping all of us to know the wrongdoing in government. But there's one major problem that we're all facing, which is the timely completion of accounts in the public sector. Sometimes it takes more than a year to finish the financial statements for an agency. Maybe it takes another year or more to finish the audits. Before it comes to Parliament, it's about 3-4 years. It seems like the time has been cut down a bit, but we need to cut it down even further. what measures would you put in place to effectively complete the final accounts of your agencies, if not the entire government sector, by way of recommendation to the finance minister? Would you possibly consider the introduction of an accountant technician certification program, which is more like, and you know that, but others may not, training people to be able to mechanically finish financial statements even if they are not chartered accountants, so that we can have the semblance of final statements before a fully chartered accountant can then look at that and then bring it to the attention of auditors. Thank you very much.
Thank you, Mr. Chair. Mr. Chair, I will need to get in there to actually find out where the problem is. The problem might not be by qualification or by the experience, and it will be very difficult for me to sit here without having diagnosed the challenge, try to give solutions to them. I have been working in environments where I do accounts recovery. Right? When I joined the main timber, they were in arrears. And in 2 years, I brought them up to date. And I was reporting a little bit close to deadlines. You know, when I came to Toyota Ghana, that was a bit horrifying. You know, but I managed to get on, and I was producing management accounts every quarter. And therefore, I'll bring my expertise to bear. We will find systems, properly define them, and I will take training and fence of our accountants very seriously. But that is an area that I will have no justification to fill this nation. So I'll make sure that if I don't do anything at all in that ministry, at least their reporting, their financials, and some level of transparency should be seen, and that will be the major impact I will have left there. Other than that, I will have failed my president, and even those of you who want to try to adopt me to become a Minister of Health. So that area will be under control, and I think I can give an assurance in that respect.
Mr. Chairman, another question bordering close to what you just mentioned, which is strengthening the internal financial controls of the health sector. The health sector has been perceived to be engaged in wrongdoing, fraud, misapplication, misprocurement, and things of that sort, widely throughout the whole country. What measures would he put in place? And would he possibly consider giving more prominence to the internal controls by way of internal audits to help strengthen these measures? Thank you.
There is an internal audit function already in the ministry, and in all its other agencies, we have internal audits working. When it comes to controls, they are there by human nature. And when you don't punish, when you don't sanction, certain things recur. So we're going to apply the rules of financial management strictly in the ministry, and I think that will solve some of the problems. I'm going to look at procurement issues, stores issues, distribution issues, supplies, several things that we need to do. And these things apparently are in my domain. And I think these are areas where we can see significant improvements within 6 months to 12 months of my stay in that ministry. And I say with all confidence that those areas we are looking at. I've got a hold of the Central Medical Stores Fire Outbreak Report. I'm studying it. It hasn't seen implementation yet. They've even recommended some more forensic audit thing to be done. And I'm going to make sure that that is implemented. After the forensic audit, we will know what we will do. But immediately, certain recommendations are in there that I'm going to carry out very quickly to sort of make people sit up to realize that you can't do things and go scot-free like it's been happening. So I don't know what next to say. I can only request that you follow me, track me, and see what I'm doing in the ministry. Maybe with your support, I can achieve tremendous success in there.
Chairman, since with your indulgence, since the nominee himself have implored us to track him, how many days should we expect you to begin action on this? And for how long should we anticipate that you would have dealt with the recommendations of the Tema Central Stores matter as a follow-up to the Honorable Adam?
Honorable Chair, I want to presume that colleague from Tamale is a lawyer. Am I correct?
He is a lawyer, in fact.
Thank you. You see, my success and actions will be consequential. Not until a forensic audit is done, I can't do what I want to do. That is in the recommendations.
Within what period will you authorize the forensic audit? Won't you give timelines to those who conduct?
If you have allowed me to finish. So we are going to procure a forensic auditor. He will do his work after we've given him terms of reference. And all these time benchmarks wouldn't be within my control. After I've spelled out terms of reference, then he will look at it, the consultant, and tell me this can complete in, say, 3 months. Not until he finishes. I'll be redundant in that respect, so I'll have to wait. So not until I get certain actions having taken place, it will be very difficult for me to predict how quickly this can be done. But I want to assure the committee that this is a very important thing. We want to work very fast on it, and I will get things done. Only that I can't spell timelines immediately. Thank you, Mr. Chair.
Okay. Honorable Yelechiri.
Yes. Thank you very much, Mr. Chairman. Mr. Chairman, my first question is about national health insurance. And I'm very happy that my friend nominee once also acted as the head of the authority. So he is quite conversant with the issues there. But you see, the NDC government inherited the national health insurance, changed the law, improved upon a few things. Then we had a challenge about payments to those who were providing service. Now, in our manifesto, we said we're going to see whether funds can be taken from our oil or petroleum funds to support the national health insurance, to do away with the challenges of the payment to the providers. Will you consider this and add it as opposed to the collapsed system that you say you have in your manifesto? In our manifesto, we had payment challenges, and it was inherent in the nature of the national health insurance as a setup. The funding sources were limited.
Hello, your question has already been given. Thank you.
Thank you, Mr. Chair. Mr. Chair, I want to assure my colleague that that is an option that we may not just throw away through the window. It's a very brilliant idea. And I think if we sit in cabinet and it's a proposal and that is what is going to work for us, we will add that as a very good source of funding health insurance to make it work efficiently again.
Mr. Chairman, in terms of infrastructure, I'm very happy that the nominee has acknowledged the contribution of the NDC in that area. But earlier on, the issue was about uncompleted projects. And some of the projects were not for the 8 years. Indeed, they were over 30 years. The examples that were given, Kolebu, and of course, there are newer projects which had problems with funding. Are you going to find some space to also continue the search that we try to search for to complete these old projects in Konfanoche, Fomina, and the rest?
Thank you, Mr. Chair. Mr. Chair, for your information, I just want to tell my colleagues that when I was the Deputy Minister for Finance, Honorable Barredu at the time took it upon himself to hire consultants who went around the whole country to pick all uncompleted government projects from health inventory It was a very large booklet that will be sitting somewhere in the ministry now as we speak. We can revisit that. I was part of that project, and I believe the intention with which we did that will still be there. And therefore, some of these old structures will be picked. Remember, I mentioned Fomina. That is one of the very old ones. During Achampon's time, you know, the NDC government, the last regime, has tried to put in some funds to, you know, try to get it done. So we will trace them. Some of them by now wouldn't be useful anymore. We'll throw them away. That is a fact. And look at the ones that we can put together. But the whole thing rests on how much funding that we can actually lay our hands on to do these brilliant ideas. I mean, implement this brilliant thinking. Thank you, Mr. Chair.
Mr. Chairman, in the area of universal health care and also particularly primary health care, the ministry has a flagship program of community health services and program, CHEP's idea. And it is one that should bring healthcare delivery to the doorsteps of difficult to reach areas and rural areas in particular, to provide services for maternal and child care services. I want to know, I've seen that in your manifesto, you are not too clear about what to do about community health and services program. What are you going to do about it?
Mr. Chair, with your indulgence, I would like to read a portion of our manifesto, page 119, paragraph E, strengthening the flagship community health planning services, CHIPS program in the areas of community participation, infrastructure and financing, quality service delivery by skilled health staff, supervision and monitoring, and surveillance and disease control. Mr. Chair, I think with this I raise my case.
You have had three. No, thank you. No, I think we have done 4. We'll come to the leadership. No, we have done 4 already.
Thank you, Mr. Chairman. Mr. Chairman, Cocoa Secretary.
And Mr. Chairman, Mr. Chairman, I want to draw your attention to Honorable Muntake's foundation to his question. He's calling me Cocoa Secretary.
Honorable Muntaka, the nominee doesn't like the description as Kuku as a Krachi. Maybe he's your friend in the chamber, do that, but here he doesn't like it, so please withdraw.
It's not only me. My community people even nickname me that. When you go to parliament, they call it Kuku as a Krachi. Meanwhile, he himself is one. He owns cocoa farms. I know him.
Hello, Mr. Chairman. That was on the light side. Congratulations, Honorable Agyeman Manu. I'm congratulating you. You are not responding.
Thank you, my brother.
Yes. When you look at the MPP manifesto from pages 115 to 121, there's a lot of things that have been said there, but the one that strikes me most is the description of our health delivery system by saying that weak primary health care. Since your nomination, you've gone to the ministry to, I'm sure, gotten a lot of information from the ministry. And I've heard you alluded to the fact that you've read a lot of documents. After all the readings, will you say that we have a very weak primary healthcare system in Ghana?
Honorable Chair, will my colleague kindly refer me to the exact portions of the manifesto where we have that sentence?
Look at page 117.
Paragraph.
Yep. So look at under the heading or the paragraph National Health Concerns. You see IV 4, weak primary health care.
I'm sorry, I still can't trace it. National health concerns. 4, weak primary health care. I've got that is 116, not 117.
116, sorry.
Right.
I'm saying that after all the information that you've gotten and read, will you conclude that our primary health care system is weak?
I should think so, yes.
Do you have an idea the infant mortality figure?
I don't think I'll be able to give it to you now.
So how did you say that after the reading, you think that is weak?
Honorable Chair, to the best of my knowledge, a very efficient primary health care will reduce OPD attendance. The disease burden, the rate at which people attend hospitals will come down. But not very long ago, Honorable, he was quoting that attendance in hospitals has gone up. And that is a good evidence, just one, for us to confirm that our primary health care seems to be weak. Honorable colleague, you wouldn't want to disagree with me that some outbreaks of cholera has been in the system the last 2-3 years. With a very efficient, strong primary health care, those things wouldn't happen. There are diseases that shouldn't happen, but we are seeing them. So we are talking about weak primary health care. We are talking about inefficient, very weak preventive systems and programs that we are running that is causing us to identify and diagnose this. But I must tell you, honorable colleague, the manifesto things that we put here, and I want to quote one person, I can't remember the name, who said once, I'm not trying to allude to this, for plagiarism purposes, that there is something they call political platform talk. Things that are put in the manifesto definitely will have some sort of things that will offend the other opponents and things like that. And at a vetting like this, you try to hit on this one for me to confirm and whether it is true or not. I believe you are pushing me into debating the entire committee, and I don't think that is what I want to do at this moment.
Well, Honorable,
thank you, Mr. Chair.
Mr. Chair, you are going to the Minister of Health. You just alluded to the fact earlier that you've read a lot of documents concerning our health delivery system. What constitutes our primary health care system? Because you just said it's weak. So what constitutes our primary health care system?
Honorable colleague, you know as well as I do that my background in medicine and health issues isn't that very strong. And for you to give me this examination question, my, you know,
so
you were teasing me to expose my ignorance.
So, Honorable Nominee, with the greatest respect, something that you have just alluded to the fact that you are not conversant with. How did you conclude that after your reading is weak?
Honorable Chairman, I'll give you an evidence. And I've said that a very efficient primary health care wouldn't make us see
with primary healthcare system. Because you see, when you talk about a system, you need to know what it is. You've not been able to talk about it, but you are talking about OPD attendance as what determines the primary health care system that we have in our country. If they ask what is the incident, what are the causes of diseases in our country?
Honorable Chair, I'm afraid I cannot seriously answer this question at this moment.
Well, the sad thing is that, Honorable colleague, with the greater respect, you were coming before us as a designate for health. And it is only fair to us that you have an idea about what, because you've just alluded to the fact that you've read a lot of documents, and what you've read, you insist that something is weak. Meanwhile, you don't even know what it is. Let's just move on. Honorable Nichu, you want to go back there? Because you are not answering, so I think we will respect each other so that you just let me have my time. In your manifesto, I wanted to ask, in your manifesto, yes, I know you have a background in financing. It's categorically stated that you increase the health financing in our country. How do you intend to do that if you are approved?
Honorable Chair, I just said that one option is engineering to bring some part of the oil funds into health financing. And I said that is an option. Prudent financial management, better controls, setting up transparency systems to cut down fraud and things like that in the ministry will give us some extra funding to bring. Now, we can go via several other options. But like I said, I will do stakeholder consultations, including some of you, to try to see how best we can source funding to move into, how do I call it, health financing. And it is the president's and the party's commitment to do that. And I'm expecting that they will scale up some more resource allocation from the national, how do I call it, resources that we shall have in the ministry to support the health sector. So that is my expectation.
Mr. Chairman, I want to take my colleague, I know he had done some work at the National Health Insurance before. When we talk about National Health Insurance utilization, what are we talking about?
Honorable Chair, that will be the usage of our membership, taking advantage of the health insurance cards that we hold to access health facilities.
Have you heard about capitation?
Yes.
What is it about?
Honorable Chair, I thought we have exhausted capitation issues. And I don't know why my colleague wants to take us back.
I'm just building on. I just wanted to get your clarity on what capitation is.
Mr. Chair, capitation is a tool to save costs when you are doing health insurance. You assign a member who has subscribed to insurance to a particular facility, and you arrange with the provider to do a tariff arrangement per capita, such that you pay some part of it or even in full upfront, And when that person needs health care, he visits and he takes care and goes away on your insurance arrangement. That is my understanding of capitation.
Currently, in how many regions is he operating?
To the best of my knowledge, 3.
You remember we were in Parliament when this started and there was a lot of resistance from especially my colleagues from Asante region. And they promised that it was going to be rolled out across the country. When you are given the nod to be the Minister for Health, how soon do we expect that this will cover the rest of the regions?
Mr. Chair, that would be a very difficult question for me to answer. We were piloting Ashanti region, and we roll out to 3 more regions. We are waiting to roll out to the other regions. But when you're piloting something, you do an assessment. Implementation is being gradual. So we will need time to assess even the 3 other regions, what is happening there and how the subscribers are accepting this capitation too. Other than that, we can go ahead. And like I said earlier on, some of these activities are consequential on certain things happening. And not until they do, it will be very difficult or naive on my part to be setting benchmarks for myself. I don't think I will be correct in that respect. Thank you, Mr. Chair.
Mr. Chairman, for some time now, the major challenge that we have in the financing in the health sector is that when the budget comes, which I know you are very conversant with the Appropriation Act, almost 70% goes into item 1, that's emolument, leaving just 30 for the rest of the activities. How do you hope to change this trend?
Thank you, Mr. Chair. I would have wished that this question would have gone to the Finance Minister. As I sit here, I can tell you about what is happening with budget implementation, Minister of Health. There is massive overdependence on IGF in that ministry. Apart from, item 1, remuneration, compensation to workers, no other release gets there. If you take the sheet for health insurance, it is no different story. So that question is like, Minister of Finance, why are you not releasing to the Minister of Health? And if you ask me this question, again, I'm afraid, my honorable leader, honorable chief whip.
The interesting thing is that you are supposed to be able to make a compelling argument at cabinet. You are able to convince your colleagues to see that your sector requires this to save A, B, C, D. You are supposed to provide the argument. And you will see in the manifesto of MPP once again about...
Honorable Chair, I think I have made that adequately clear this afternoon here, that I will solicit your support. I will put my proposals before cabinet, and I'll try to, push them to give us what we need in the health ministry to do the things that we need to do to have an impact. So I've said that already, and I was even alluding that if you parliamentarians support me succeed in that ministry, some huge burden will have been taken away from you. So it will not only be me, the health committee in Parliament, you'll see to the implementation of the budget, and I think some of the pressure should also have to come from you. I don't know if you're going to continue to be the chair of that committee or not. So when you sit down with the finance ministry and the health ministry, and we show you a budget implementation, and after the end of the ninth month in the year, they haven't released anything for goods and services, then it is not only the health minister who should put pressure to bring money. It will be part of our responsibility as parliamentarian to also do that. Thank you, Mr. Chair.
Well, Mr. Chairman, under the given circumstances, I will just end here. Thank you very much.
And thank you too.
Honorable Vice, do you have any question for the nominee?
My former chairman. Congratulations, my former chairman.
Thank you, Ajua. Ajua, this is the reason why I said change has come over. Ajua, you see where you are and where I am.
Chairman, I'm in your seat now. Just to congratulate you on your nominations. And just a quick one. I want to find out from you. I remember in the 6th Parliament, there was a question that was filed by a member on the floor to the then Minister for Health concerning some ambulances that had been procured. And upon arrival, it wasn't fit for the purpose for which it was procured. So I want to ask, these are huge, huge sums involved in such procurements. If you're made, or when you're made Minister for Health, are you going to ensure or promise Ghanaians that you ensure that all procurements done will meet the required specifications and the right value for money will be done?
Thank you, Chair. I think I can give that assurance. I'm going to try to work harder to actually strengthen the procurement unit and improve on the work in that unit. But the assurance is that the little investigation I've done so far leads to the fact that no money has been paid for those ambulances yet. We'll continue to do investigations. We need the rolling stocks to beef up our service, and therefore we call the suppliers to see what they can do about them. We'll work on that. So only give me the note, and I think I can give an assurance that we'll work in that respect and report to Parliament. Thank you.
Honourable Ranking Member.
Chairman, let me thank you and thank the Honourable Kweku Agyeman Manu, and to wish him well as Minister Designate for Health. If the way he performed at the Public Accounts Committee is what we will measure him with at the Ministry of Health, we expect improved access to quality and affordable health care. Suffice it is to ask him that maternal and infant mortality, UN Millennium Development Goals, many African countries, including Ghana, is still struggling to ensure that mothers don't die whilst giving birth and children don't die before attaining the age of 5. What concrete plans do you have to improve maternal and infant care, or to avoid the incidents in our country healthcare system?
Thank you, Mr. Chair. Mr. Chair, I think the maternal and infant mortality issue are benchmarks in the Millennium Development Goals program. Presently, there is a program running in the ministry we call the Millennium Accelerated Framework 2. That seems to be addressing the deficiencies and the challenges that we still have in that area. And when we complete the implementation, we want to believe that we may have delivered to the level that these issues will have been impacted upon very, severely. So not until we finish the program and we do some assessment, I wouldn't want to try to come in with any new plans. We want to complete this program and see how best we can move away from that area. I believe we are on course in achieving certain targets that we have set for ourselves. And after the completion of this program, I think we will get there.
Honourable Chairman, can the nominee give assurance to this House that between your first, second year, we can anticipate an improvement in all the indices for both infant and maternal care?
Mr. Chair, the assurance I can give is that I would like to bring a report to the chamber, to the House, after my first year in in the office, to the performance in that area. And probably we may be happy, or we may see more deficiencies, and we'll have a plan to correct it. Mr. Chair, the good news is that the medium-term development plan for the ministry comes to an end this year. And therefore, that is an opportunity for us to look at our deficiencies and our challenges, to try to adopt new programs in our next plan that we will do, which we will do this year. So some of these challenges will be addressed. So by the end of the year, one will do our overall assessment of where we are finding serious challenges and we are defaulting. We will address them in the next 3 years plan. And when implemented with good source of funding, I believe some of these challenges will be addressed.
Thank you, Honorable Nominee. Chairman, access to health care remains a fundamental problem for aged persons in our country, particularly persons between the age of 60 and above. And for many of them, they are unable to access the kind of medication that they want using the National Health ID card. And for many of them who are not even in a formal pension regime, are unable to access health care, that is affecting that category of people who are in the most distress of their stage of development. Do you have any specific plans for those persons in the delivery of your healthcare plan as Minister Designate?
Mr. Chair, I've been thinking of the elderly and how they access healthcare in our country. The health insurance is the one sure area that we can utilize. But like we have identified, we need to do a little bit more strengthening in that area. So we're going to see some restructuring and certain reforms. And I believe we may want to do some exclusive medicines list for the elderly to take care of them. It is part of the manifesto pledges that we will see to ensure that the elderly get the adequate health care that they need. So we'll address them. And I think not until we give it time, we get some space to do this work. Again, I won't be able to, how do I call it, predict how successful our plans shall be. But there are plans that we can roll out to address these challenges.
Chairman, under the National Health Insurance Act, indigent and persons who are not up to a certain age, will the minister want to initiate legislative reforms that can assure this aged category that they would be considered for purpose of accessing health care using the National Health Insurance Scheme?
Honorable Chair, like I said earlier, health insurance objective is to ensure that all of us, without leaving out any single one person out of the frame, to have affordable health care, adequately covered. And so the type of restructure and the reforms we're going to try to mount will be supported by legislation. And in there, we will all get opportunities to actually tap our brains into it. Like I told you, I will do a lot of consultations, and I'll do stakeholder meetings and engagements. And these challenges, I don't see them as things that will ever be permanent with us. They are within human comprehension. And with brilliant ideas, questions that you're asking, others have, these things are not unsurmountable. We'll get over them.
Mr. Chairman, I was wishing the minister well. One of the major problems of your sector, which you yourself alluded to, is you have very wide and varied workers, from doctors through pharmacists, through nurses. A major problem still persists within the health ministry. I should recall that I attempted to help address it by even tinkering with your HRM system. You have medical doctors passing out of the known and established medical schools. You have nurses passing out. Yet between when they get out of school and when they get into the public sector as formal employment, the ministry have never been able to have a hold on it. What assurance will you give to this committee that you will not have a break in terms of the posting of doctors and other allied medical practitioners?
Honorable Chair, I've said over and over again that some of our activities are consequential of certain events happening. If you do not get financial clearance from the Ministry of Finance, a commitment to pay their salaries, compensation to them, we cannot employ. And I can write, I can follow up, I can shout at cabinet levels, I can seek audience with the president and plead with him to move funds into the area for us to do what we have to do. If all these things are not coming, honorable colleague, it will be difficult for me to sit here and say that we'll put them immediately, they finish, we'll put them immediately, finish. It is just not going to be workable. But we have a new regime that is committed to rectify things that may have gone wrong, and it's a challenge. And I believe that we are committed to solve the problems. So we need certain space to look at what is available, what is the real situation like, what we can do quickly, where we can find the money, and then we can move on. This sort of area, my former friend, Honorable Yilechre. Yes, please, can you put on your microphone and you want me to tell a story? No. Okay, it's getting late. My former friend alluded to, even if we decide at cabinet level to use some part of the oil funds, we may need to come to Parliament to probably do some changes to the legislation. And again, that will also depend on how acceptable our proposal shall be to Parliament after our debate for us to enact that law, to be able to touch even that funds to put in there. So consequential events should happen, and not until they do, I cannot easily, Honorable Chair, set benchmarks for myself. Thank you.
Chairman, didn't you anticipate this difficulty when you pledged that nurses would be employed, allowances would be restored? You have 14,000 nurses on standby since 2014 who obviously, because of the very reason you are now stating, absence of financial clearance, were not posted.
Honorable Chair, we anticipated and we're asking why budgets were not performing. So why Minister of Finance wouldn't put the monies there? As we sit here, some of us haven't found any good reasons for that. I may assume overcommitment elsewhere, and therefore monies that should have come wouldn't come. Certain more important things will have happened for us to do. And some of them, I wouldn't know what they are for. So though we knew challenges, we were telling people, we weren't telling them why government is not employing. We were telling them why they were not releasing financial clearance. Ministries were applying for them, they were not getting them. The bottom line was that money was not available. We knew all this. But when you come into office, when you know, anticipated that there will be no money, you're going to look for money and find the money, you need a little bit of space to be able to actually set benchmarks for yourselves. Let us wait and see what happens in March when we see the first budget coming out. And that is where we can probably, on the look of what plans we have and what monies we think can come to the ministry, we can then rule out certain programs. And that is where our benchmarks can be defined.
Are you aware that graduate nurses who have turned out of the universities remain unposted and are urging that before the end of this first quarter, you are able to secure financial clearance for them to be posted? Are you able to do that?
Honorable Chair, some of them have got my number, and they are even calling me, talking to me about their plight. And I keep on telling them that they should wait, just like I'm requesting that we should also wait. So not until I see what is coming out of the budget, it would be very naive on my part to sit here making promises and pledges again. So I think that you'll have patience a little bit. We are all very concerned and worried, and we can't solve the problems tomorrow morning. And that is the bottom line.
Chairman, my autonomy for some of our health institutions, given your very deep financial and management background, even if any person would have been forgiven for lack of knowledge, you know that compensation was part of what was negotiated with the fund program, and therefore there were limitations in trying to reduce the budget. Would you want to make Tamale Teaching Hospital, Komfo-Anokye, and Kolebu, why wouldn't they be on their own as autonomous institutions as a way of improved financing to improve their delivery of health care?
Madam Chair, if you take a good look at our manifesto, we are putting that we will try to engage PPP arrangements to see how private sector involvement into health facilities and health sector will support us deliver health service, efficient and quality healthcare in our country. So that is already in our manifesto, and I think we're going to go along that lines. So far as the country will be the first to benefit than the private sector person who is bringing in the money. Thank you.
Finally, Chairman, he himself alluded to enormous investment in health infrastructure manifesting in almost every region of Ghana, with the exception of the western and eastern region, having a dedicated regional hospital, district hospitals ongoing in many other parts of the country. But for rural communities, the cheap compound principle, I know the ministry was already undertaking that exercise. Can we have indication from you how you intend to make that available, and probably give us time levels that we should expect that between this period and that period, you will add to the stock of health institutions, in particular focusing on deprived rural areas, and that should be related even to the posting of doctors and nurses, where you have many of them in an urban area with reluctance to accept posting into the rural areas, and that is affecting health delivery in the deprived part of their country. Thank you.
Mr. Chair, I think these have been concerns that have been expressed over and over and over and over again. I will take note of his concerns, and they will become part of my concerns as well. And I will look at what it is. Again, in the manifesto here, I read about the cheap compounds. So everything that has been started, that is there, we are picking them up. And so far as these things have started, I call them opportunities that we can tap into. And we wouldn't let opportunities go away. We'll continue to do things that will benefit our citizens.
Chairman, he is lucky as minister. I see the chief director of the ministry. You are taking office at a time that for the first time in many years, we have codified conditions of service for the health sector, thanks to some work that the previous government did. But the Ghana Medical Association, and in particular pharmaceuticals, are still dissatisfied with their rating in terms of access to market premium in respect of the single spine. And the Ghana Medical Association, with very poignant leadership, expect a takeoff of the full implementation of their conditions of service. Can we have your word on that?
Thank you, Honorable Chair. Honorable Chair, I think I've said that I'm going into the ministry with a position of engaging these associations and labor unions. I have also said that I will have to engage them to the level that they will accept a truce that I may declare on agitations and strikes for at least 6 months. And I believe that I can have some goodwill in there. They will give me space. During that period, I will have to study, I'll have to consult, I will come to you. I am very much aware that we are part of the codification of the service conditions and all the challenges you started them. I will come to you, Honorable Haruna. I wouldn't hire him for a consultant. He's a good friend who will just advise me for free, So that is what we're going to do there. And I've said again that there are challenges. We can't run away from the challenges. Whatever the situation, it's one of us who will go there to solve it. If it's my turn, I will do the best that I can do to try to resolve the matter. And I think that will be it. Thank you, Chair.
Okay, thank you, Honourable Member. I have one question myself. In Asantitri, we say, "De o susuneniwa." The person crying cries for his own reason. I am asking you on a matter relating to Bekwai Hospital. What did you expect?
Can I preempt your question?
Please hear me out.
I was going to give you good news.
I don't worry. I want my people to hear me ask you before you give me the good news. The Ghana Hospital project started in 1973. I was in primary school. The first day the sword was cut, I was carrying my father's chair. I sat there. It delayed and delayed and delayed, and it was repackaged under President Kufuor. From 2003, sword was cut by President Mills in 2010, and to date, we have not finished the project. Can you assure me that we'll bring a closure to this matter for President Akufo-Addo to inaugurate the hospital before his first term as president?
Honorable Chair, I said I was going to try to preempt your question, but thank you for actually coming out with this. Honorable Chair, with your indulgence, I want to read from a note that I have, a brief that I've intercepted, specifically on the completion and equipping of Bekwai District Hospital. Both cabinet and parliamentary approvals have been received to contract the loan for the construction. There is the project submitted proposal. There is a loan that has been found with African Development Bank. We've got all approvals. We're only waiting for the value for money audit report to proceed to Parliament for the approval of the supply contract. And what I plan reporting to the President as part of my transition reports is that the first 100 days of Nana Akufo-Addo in office, we should see some serious construction activity on Bekwai Hospital. Thank you, Chair.
All right. I will hold you to this, and I'll be at your tail until it's done. Now, Honorable Nominee, thank you. I'll call on the ranking member to announce and identify the dignitaries that are here with that. Sorry, the Chief Whip, Majority Chief Whip.
Thank you, Mr. Chairman. The following people accompanied the nominee. Representing Nana Domahini are Barima Dei Kusi Jaba II, Amasuhini and Ankobiahini of Doma traditional area. Barima Oponcheme Sikafo, Akwamuhini of Doma. Nana Afrakuma, Akwamuhima of Doma. Family members include Honorable Yao Unto, a former member of parliament for Doma East, Kwabna Into, spouse, Mrs. Susanna Agyeman Manu, sons and daughters. There are many, so you couldn't list them. The party is also represented by the second vice chairman of Doma Central, Mr. Henry Opon, and the constituency secretary, Mr. Kwesi Damwa. The chief director of the Ministry of Health is here, and representing the Doma Hospital are Dr. Adoma Jomo Foku, medical administrator, Godwin Ahiaku, accounts manager, and Kofi A. Sapon, administrative manager. Thank you, Mr. Chairman.
Thank you. Honourable Member, you're discharged. Do you hear from us?
Thank you, Mr. Chair. I don't want to get back to questioning, but I just want to crave your indulgence to also acknowledge and thank my former colleagues on the Public Accounts Committee, some of whom are not coming back to Parliament, but they came to give me moral support. They liked their chairman and they want their chairman to succeed. So Honorable Rahel Apo is here. Honorable Abna Osiesari is also here. Honorable Ajwa, she's now a big lady, so
it is very interesting to observe that all of them who came to
all
support
the three
you.
MPs from Doma are here. The Doma East current MP, Honorable Sambi, and Honorable Ali Mega, who is the Doma West MP. Thank you.
It's very interesting to
Dr.
observe.
Miama is my in-law, brother-in-law. He's here. He comes from the same place with my wife, a brother and a sister. So thank you.
I wish to observe that all the members from the public accounts who came to support you are females. You are discharged.